You know, guys, I don't know if it is me or what, but it looks like some South Africans are now getting sick and tired of the consequences of open borders. And sitting over here, I wonder if this issue is going to be enough to convince South African voters that these politicians that you love so much are not here for you. I wonder if this issue of illegal immigrants crowding the public healthcare facilities is going to be enough to convince majority of the people of this country who happen to be poor black people that these politicians that you admire so much are not here for you. Because if you look at how South Africans have been voting in the past 20 years, it's almost as if South Africans were oblivious to the mess that the country was getting itself into. Because South Africans, they love their politicians. South Africans, they love these popular politicians and popular political parties. And they would vote for those political parties even at the expense of the country. South African voters are not the type of people that go to the polls and look at the country and saying that, guys, our country is in a lot of trouble. What can we do? What can we do to actually fight for our country? But South Africans, they go to the polls and they vote for their favorite politicians and they vote for their favorite political parties. And they do that even at the expense of the country. So these decisions that these politicians are making are directly impacting poor people's lives. I mean, right now, this issue of illegal immigrants crowding the public healthcare facilities is directly impacting poor people on the ground. These are the consequences of open borders. And this is the reason why I'm sitting here and I'm like, I wonder if this is going to be enough. Because something has to be enough. South Africans, at some point, they will have to be forced to make the decision that is best for the country. And I think this issue, it has the potential of changing people's minds and to force people to look at politicians differently, to force people to look at these NGOs and these mainstream media that are speaking on behalf of the illegal immigrants. I hope that this situation is enough to convince the people of this country that the people that have been governing this country do not have their best interest at heart. I mean, guys, I'm not sure if you are aware, but in the past couple of weeks, there have been videos that have been circulating online. And on these videos, you would actually see South Africans and members of organizations like Operation Dudula on the ground, chasing out illegal immigrants at the public healthcare facilities. And it is frustrating because South Africans are now facing a situation where sometimes when they go to these public healthcare facilities, when they go to the hospitals or they go to the clinics, they cannot receive help because the facilities are filled with illegal immigrants. And it is frustrating to the people on the ground. It is frustrating to the people on the ground. So Operation Dudula, Operation Dudula, they don't like this thing of open borders. They don't like this thing of illegal immigrants basically abusing the resources that are paid for by hardworking South Africans. They are on the ground with South Africans and they are doing the Lord's work by chasing out illegal immigrants at the public healthcare facilities. Because at some point, somebody had to do it. Somebody had to do it. I know that right now, the government and the NGOs and the mainstream media, they are coming with guns blazing, condemning these people that are chasing out illegal immigrants at the public healthcare facilities. But the truth of the matter is that we have limited resources, and these resources cannot cater for everybody else. But that's the thing. We have limited resources, and they cannot cater for everybody else. And we have seen the videos of illegal immigrants basically threatening South Africans to kill South Africans. There are footages like that where the illegal immigrants are threatening violence to say that if you guys don't give us free healthcare, then we're going to cause a mess in this country. And these are the people that are not even demanding these kind of things in their own countries, but they come to South Africa and they have the audacity to demand the free healthcare in this country. These are the consequences of open borders. These are the consequences of people who have been voting for the cadres for the past 20 years. This is what you get when you vote for the cadres. But I know that South Africans do not want us to link their votes with the mess that the country is going through right now. So Operation Dudula and ActionSA are not quiet at all. ActionSA is also in the fight. They are fighting. They are saying that, no, this issue, it needs to be resolved. And this thing of trying to cater for everybody, it is unsustainable. It cannot happen. It cannot happen. And South Africans cannot be forced to pay for the healthcare of the illegal immigrants when we have the people in this country that cannot even receive the healthcare. It is a mess, guys. It is a mess. So this is one of the videos that actually went viral of members of Operation Dula, basically showing how empty the hospital was without the illegal immigrants. And I guess the people that are in the hospital right now are only South Africans.
Empty. Phumile zizimbane. Silitholile li-1 liphumile. Phumile ekliniki yethu. Ekliniki yethu. Ozaziyo ukuthi akasiyo wase South Africa, sicela ukuthi asiphumele aye private clinic or aye a private hospital.
So this lady is basically saying that if you are not born in South Africa, please go to the private hospitals or private clinics. But we don't want you here at the public hospitals. We don't want you here. And she basically did this video to show the people that it is empty, and we think now people can actually get the help that they need.
South Africa for South Africans. South Africa for South Africans. But for now, we say empty.
And guys, by the way, this issue is spreading out. It's spreading out. I hear that right now it's even going massive in KZN. And there are people on the ground in KZN that are doing the same thing that Operation Dudula and other organizations have been doing in Gauteng. So it looks like this is going to be quite a big issue in this country. It looks like it is going to be quite big. You know, last week I was actually monitoring the situation, and I thought that maybe it's just one of those instances where you would see organizations trying to do what to get their names out there. But once I started to follow this story, I actually realized that this story actually has the potential of becoming one of the biggest stories in this country. So this thing is spreading out. South Africans are sick and tired. South Africans are basically sick and tired. So Operation Dudula says that they will never stop preventing foreign nationals from receiving health care at the state facilities. So this article says that Operation Dudula leader Zandile Dubula said the group would not stop preventing foreign nationals from receiving health care at the state facilities. This despite the Human Rights Commission condemning the protest, saying it was deeply concerned given that the right to access to healthcare was a universal one. So, you know, the Human Rights Commission, man, they always come out when there is something against South Africans. These people, somehow, they call themselves South African Human Rights Commission, but they don't say anything about the mess that this country is going through. They don't say anything about the abuse that the taxpayers of this country are facing. But as soon as the people say something, the South African Human Rights Commission is out there condemning South Africans. So protests have broken outside healthcare facilities in the metro, with some insisting that South Africans only get treatment. In one of the ongoing protests at the medical facilities, some South Africans from Rosettenville, southern of Johannesburg, have been manning the clinic, blocking any undocumented foreign nationals from gaining entry. They have been blocking and saying that you are not going to get here. You are not going to get here.
Monday until next of next day, until we win. Our contribution from South Africa, that's what we're doing now. Hello, Papa. If you have an IT, only allowed so good in your quiet. Go back home, darling. Then you can go to the private clinic. I'll go and interview them. Sorry. Okay. Except you have ID, Papa. Sorry. Foreigners are not allowed. They are using passports as well. Yeah. There's a lot of this clinic is for us, South Africans only. South Africans first. South Africans only. As the constitution says South Africa, so we are not doing that. It's not a constitution. It's not a
And guys, this is so sad because it was never supposed to get to this point where South Africans would have to man the clinics by themselves. It was never supposed to get to this point. And till today, I still do not understand why the comrades allowed the borders to be open. I genuinely do not understand. Because if you don't have the borders, you don't have the country. I wonder why, or what actually made the politicians feel comfortable to say that we are opening our borders and we are not going to guard our borders. I mean, like right now, this issue of open borders, it has come with many bad consequences. It has come with a lot of troubles. It is not only the issue of illegal immigrants at the public health care facilities. We are also looking at the issue of crime. We are looking at the issue of abductions. We are looking at the issue of carjacking. And most of these crimes that are happening right now, they can directly be linked with the open borders. And the criminals in this country, they know that you can commit crime in this country and you can easily get out of this country because this country does not have the borders. That's why you would see illegal immigrants coming into this country and causing havoc. Because they know that in South Africa, you can commit crime and after committing crime, you can just skip the borders. And nobody is going to arrest you. And after some time, you're going to come back and commit crimes again and then skip the borders. What was the purpose, man? What was the purpose for the comrades to actually allow a situation where the borders are not guided? What was the intention? What was the intention? Because right now, South Africans are being condemned. But the people on the ground are telling you that we are struggling to get health care and we are struggling to get help when we go to the clinics or hospitals because these people are all over the place. And it is unfair because the people that are paying the taxes are hardworking South Africans. And these taxes of hardworking South Africans are supposed to help the people of this country. Not the entire Africa, because this is what is happening right now. It looks like the entire Africa is coming here. It is coming here. And the people of this country cannot even say anything without being labeled xenophobic. They cannot even say anything without being condemned by the government, by the mainstream media, by these NGOs. I honestly do not understand. So, of course, the mainstream media, it has already started to invite the NGOs. It has already started to invite the NGOs so that the NGOs can insult the South Africans, so that the NGOs can undermine South Africans. Of course, they have already started. This is the mainstream media. It is the mainstream media. Like, it's quite fascinating how fast these people are to invite these people from the diaspora, and knowing that these people from the diaspora organizations always insult South Africans, despite the fact that South Africans are the ones that are paying for these things that they want for free. Because it seems like this is something that these people do not understand, that everything that they get for free, somebody actually paid for it. Somebody paid for it. And this is something that even the people on the ground, they need to understand, that there is nothing for free. There's nothing for free. Everything that you get, supposedly for free, somebody actually paid for it. But somehow, they believe that no, the state is the one that is taking care of everything. So these people of this country, they do not have the right to say anything about what the state does, because the state is paying for everything. I get the sense that these people, whenever they speak, they feel like South Africans and their taxes, they have no link to the business of the state. They have no link to the business of the state, and that's why they can come into this country and abuse the resources that are paid for by hardworking South Africans, because they don't actually believe that South Africans are the ones that are paying for these things. They don't believe that South Africans are the ones that are paying for these things. And what is more disgusting is that they come into this country, they start making the demands. They go on national television and insult the South Africans, and they don't have the audacity to say these things in their own countries. There is law in those countries. You can't go to Zimbabwe and be on a national television and start talking nonsense about Mnangagwa. They will show you flames. They will show you flames. But in South Africa, it's free for all. Free for all. Anybody can come from anywhere in this continent. As long as you are in this country, you can start rubbishing even the people of this country that are paying for things that you are fighting for. The South African government has made these people disrespect us as the people. They've made these people disrespect us as the people.
Can you describe the scale and impact of what's happening on the ground right now at some of these public hospitals?
Thank you very much. Good afternoon and good afternoon to the viewers. Well, look, this is growing. I mean, it started maybe at a relatively smaller scale, but seeing what has happened, in other hospitals, including in Soshanguve and Durban, this is growing, and unless it is abated, because you can see that we've seen that happening initially in Gauteng, but now it is in Durban. And this shows that now it's becoming countrywide. We know that it has also happened at some stage in Polokwane, but now we can see that it's gaining traction unless, proper steps are taken to enforce the law and ensure that, these groups that are resorting to self-help and vigilante groups are obviously taken to task. This is going to...
They say that Operation Dudula and South Africans that are fighting for South Africans to be prioritized at the healthcare facilities are vigilante groups. South Africans that are fighting for South Africans to be prioritized at the public healthcare facilities are vigilante groups, according to this guy.
Grow and embolden other people that might think it is the correct thing to do.
Now, do you have an idea of the numbers of individuals that have been impacted or that are being impacted by this process?
Well, I mean, apart from the numbers that, obviously we get from various publications, but we have seen from video footages quite a lot of people being turned away. So, I mean, I might not really say that these are the numbers, but as a result, we have seen some of the, even some of the clinics where people would ordinarily go becoming very, very empty instead of actually having, people, attending, clinics. And we have seen in Soshanguve at some stage quite a good number of people in OUTRAGE, a good number of people, tens of people being turned away. So the numbers is unconfirmed, but obviously it is clear that we've got probably thousands of people that have been turned away this far.
Like these comrades men they are trying to legalize the illegality. This is what they are trying to do. They are trying to legalize the illegality. I don't know if the comrades actually see that South Africans are sick and tired of them, so they are trying to get a new voter base. This has been my conspiracy for a very long time, that I think one of the reasons why these comrades have opened the borders and allowed these illegal immigrants to come into this country and to give them these benefits is for them to actually create a new voter base. So basically replacing South Africans with the people that come outside of this country that are completely desperate and knowing that if we can give these people a few crumbs, then they are going to vote for us. I think maybe this is one of the intentions of the comrades. I think so too. I mean, like, even if you look at the EFF and the backlash that the EFF has faced over the years because of their stance on the illegal immigrants, it's almost as if Julius Malema also wanted the same thing. Because they are saying that, no, these people are already in the country, man. No, so document these people, man. Give these people, document these people. Make these people legal in this country. And you, as a political leader, you start to speak on behalf of these people and you start to defend these people. Of course, you're going to get the votes from these people. You're going to get the votes from these people. So I somehow feel like South Africans are being replaced by these people. I actually feel so. And if you listen to the testimonies, the nurses are complaining about the attitude of these people that come outside of this country. The nurses are saying that these illegal immigrants, when they arrive at the public healthcare facilities, their attitude is stinking. They have a stinking and they have a entitlement attitude that they should be helped, they should be prioritized, and they cannot be turned away. And these people are literally abusing the South African nurses that are paid for by the taxpayers of this country. I don't know what it, I actually do not understand how these people in government actually operate. Because not so long ago, we were complaining about the issue of the Bela Bill and how the Bela Bill has allowed the children of illegal immigrants to be enrolled in schools without providing any documentation. So you, as a South African, you have to run around to gather the documents while the children of the illegal immigrants are being enrolled in schools without providing any documentation. And we are still dealing with the issue of the children being misplaced, the children like not being able to find spaces in schools because the Bella Bill has came into effect. And now the illegal immigrants, they can just hand their children to the schools and they don't even have to provide any documentation. And they are getting assist. And even in public healthcare facilities, it's still the same thing. They go there without an ID, without nothing, without documents showing that you are in this country legally, without nothing. And they get help. While South Africans have to produce the documentation. Like South Africans right now are being treated as second class in their own country. And they are shocked that this is what is happening. They are shocked. And even the health department is condemning the people, patronizing. They are saying that the people are patronizing undocumented foreign nationals. So the Department of Health has condemned the actions of groups blocking access to health care facilities to deny treatment to patients who are undocumented foreign nationals. They are condemning the people from stopping these undocumented foreign nationals filling our public health care facilities. And they know that it is unsustainable. They know that we don't have enough resources to cater for everybody else, but they are still supporting the idea of helping everybody else, helping the entire Africa. There has been a reported increase in such actions, which are being justified as efforts to ease pressure on the burdened healthcare system. Department of Health spokesperson Foster Mohale says, quote, "We have noted the actions by the individuals and organized groups who visit our healthcare facilities, demand to see the documentation of all our healthcare users, especially people who are undocumented," close quote. "We understand the concerns, but we don't agree with the approach in which they are conducting this. We still believe that this can be addressed through legal matters. This is not only a violation of our constitutional right, especially Section 27, but also a number of illegal prescripts, the National Health Act, the Refugee Act, Immigration Act. So these illegal actions, we condemn them in the strongest possible terms." Meanwhile, the Human Rights Commission says such practices are not only unethical and unlawful, but also inconsistent with South Africans' obligations under both domestic and international human rights law. Human Rights Commission Sandra Makosha says, quote, "The Constitution provides all those within the Republic of South Africa with the access of healthcare, including emergency healthcare. Therefore, the treatment of foreigners, whether documented or undocumented, by preventing them from accessing the healthcare services is unconstitutional and violates not only the Constitution and other laws in South Africa. Furthermore, South Africa has international obligations to respect of providing access to healthcare to all within its borders." Man, I don't care about the international obligations. I don't want to lie. I don't care about the international obligations. So when you see stories like this happen, man, as a South African, you would think that, okay, maybe some of these departments they will come out to say that, guys, we know that what our constitution is saying, but let's be fair. Let's be fair. This is unsustainable. This is unsustainable. But even the healthcare departments are coming out to say no. No. What you guys are doing is wrong. You must continue to pay for the illegal immigrants to have the benefits in this country. You must. You have an international obligation to do that. You must continue to pay so that the illegal immigrants can continue getting the benefits in this country. It's mad, man. It's mad. So the South African Human Rights Commission, obviously, they released a statement. And guys, like I said before, the only time when these people come out is when there is something against the South Africans. The South African Human Rights Commission, man, I think this is one of those organizations that should be disbanded. These people are completely useless. This organization is completely useless. I mean, in this country, I mean, even just looking at the issue of women and how women are being abused and raped in this country, and the number of women that are being abused, being raped, are being abducted, I don't see South African Human Rights Commission saying anything. I don't see South African Human Rights Commission saying anything about the abuses that the taxpayers of this country are facing. I don't see these people saying anything about the issues that are concerning South Africans. But whenever they release a statement, just know that statement will go against the South Africans. I don't take these people seriously. I don't take these people seriously, but somehow they are taken seriously. So this vigilante group says that the South African Human Rights Commission reminds the public and all relevant stakeholders that the right to access healthcare services in South Africa is a universal right afforded to everybody within the Republic's borders as guaranteed by the Constitution. Section 7.1 of the Constitution of the Republic of South Africa 1996 clearly states that everybody has a right to access the healthcare services, including reproductive healthcare. This constitutional provision means that all people in South Africa, regardless of their nationality, legal status, race, gender, age, income level, or geographical location, are entitled to access to basic healthcare services. This includes, number one, South African citizens, refugees and asylum seekers, documented and undocumented foreign nationals, stateless persons, children including separated, unaccompanied and stateless children, persons in detention, vulnerable populations such as people with disabilities, the older persons, and people living in poverty. The Constitution does not qualify or limit these rights based on immigration status or citizenship. So I guess, guys, it's safe to say that the South African Constitution is totally against us. The South African Constitution is against us. It's against us. So the Commissioner of Human Rights Commission of this group that I don't like so much was on radio, and she was furious at South Africans. Furious. Saying that how can South Africans actually do something like this?
But we're not only seeing Operation Dudula, we've also seen videos being circulated on social media where officials within the healthcare system themselves are treating these migrants differently in terms of access to healthcare.
And that's a clear violation not only of the mandate as healthcare practitioners, but it's a clear violation of Section 27.1. And I think you said emergency, but in terms of Section 27, it says everyone has the right to have access to healthcare services, including reproductive healthcare. So they really need to understand that we are a constitutional democracy, and turning away and people based on their nationality is a clear violation of South Africa's constitution, but also we've signed treaties as a nation in terms of universal health care. So then it results as a country we are violating those treaties.
Shouldn't there be?
But guys, isn't this some sort of violation to South Africans, to force South Africans to pay for the health care of illegal immigrants? I think that it is some sort of a violation. I think like there's something that we could find there to say that it is unfair and it is a violation to force South Africans to pay for the healthcare of illegal immigrants. What about the violations that the people of this country are facing? What about them? What about them? Quick to tell us that this is a violation. But now South Africans are being violated in their own country. What about that? South Africans are being violated in their own country. They are. And I know this is one of those videos where you will have people calling us as xenophobes. But then it's fine. You can call us xenophobic as you want. It's fine. It's fine.
We are violating those treaties.
Shouldn't there be tougher consequences for those violations?
We are waiting for the outcome of the judgment. We are hoping that the
So they are calling for the tougher consequences for the violations, the people stopping the illegal immigrants from getting the healthcare facilities. But they are not calling for these people that are jumping the borders. They are not calling for harsher punishment for these people that are jumping the borders. They are not calling for harsher punishment for these people that are jumping the borders. And what about the people that have allowed the borders to be open? When are these people going to be held accountable to say that, guys, we are facing these issues today because you opened the borders? Nobody is holding these people that have opened the borders accountable. Nobody is doing that. Nobody is holding these people that are jumping the borders and getting into this country illegally accountable. But somehow South Africans have to be held accountable for saying that we don't want to help these people with our tax. They want to hold the South Africans accountable, but don't say anything about the people that have opened the borders, and don't say anything about the people that are jumping the borders. But you, as a South African, you must just shut up. This is basically what these people are calling for. South Africans, you must just shut up and continue to pay for these people. Shut up. Shut up and pay for these people. I mean, like, these people, man, like, in government, when these people can, like, they can clearly see, they can see that South Africans are now facing tough situations in these public healthcare facilities. And they know that them being in government, their priority is to ensure that South Africans are okay. But somehow they are condemning South Africans when South Africans are showing them that, guys, this is unsustainable. It cannot continue to happen. And now you have the people in the media calling for the government to hold the people accountable. To hold the people accountable. I think maybe this conversation here, it was supposed to be about the government and allowing the situation where the borders are open and what should be done to these people that have done that. The South African Human Rights Commission, you can see that the borders are open. The people are dealing with the issue of illegal immigrants. Some of these people that are in the country illegally, they are committing heinous crimes. And these are the consequences of the politicians and the decisions that the politicians have made. What are you going to do as South African Human Rights Commission? Because you are supposed to put South Africans first. But no, it's not like that. It's about holding South Africans accountable, not holding the politicians accountable.
The South African Police Service advises those who are taking the law into their own hands, and that we see that repercussions are taken. We need to continue to respect the rule of law. And as you note in our statement, we say that we hope that the Department of Home Affairs and the South African Police Service do their...
I mean, like, come on. There's nothing like respecting the rule of law, like jumping into this country and getting here illegally. If you are illegal in the country, you have already broken the law. So you are telling South Africans to respect the rule of law, but then you don't say anything about the people that are jumping the borders and getting into this country illegally, because that is a violation of, that is breaking the law. That is breaking the law. So we have to be consistent when we speak about the people that are breaking the laws. Let's be consistent. Let's be consistent. Because these people have never acknowledged that these people that are jumping the borders and getting into this country illegally are actually breaking the law. This is not something that they have said. This is not something that they have said.
Do?
We are continuing to monitor the situation. We have received individual complaints. We've made oral submissions in terms of the case that was taken by Kopanang Africa. So we are working. We're also then dealing with the systematic issues. Without dealing with the systematic issues, we have vulnerable members of the communities challenging each other, taking the law into their own hands, fighting for limited resources, when the real concern is how do we then address the systematic issues.
So that's the commissioner of South African Human Rights Commission. There's a vigilante group that is called the South African Human Rights Commission. That's what she says. What are your thoughts, guys? What are your thoughts about what these people are saying? What are your thoughts? What are your thoughts? And like I said earlier on, guys, that ActionSA, it has not been quiet. ActionSA has not been quiet, and they have been very vocal. They've been very vocal about what the South Africans are going through. They've been very vocal about how these people are abusing the resources of this country.
You heard what the commissioner from the South African Human Rights Commission had to say there, Sandra Makwashe. What's your reaction as ActionSA?
Thank you very much, Aldrin, and good morning to the viewers. You know, we responded to the South African Human Rights Commission purely because we would like them to be consistent in their mandate to support human rights and to protect human rights.
Yes.
Let me underscore it by also saying that we as ActionSA broadly are not against human rights or affording people who are vulnerable assistance in our country. But I think it goes without saying, and it's very clear now, that we've got a situation where the system is being overrun. And I want to make a simple example that says you cannot take on or live beyond your means. And currently we are living beyond our means in South Africa. Our hospitals are being overrun. I can tell you, my colleague, Dr. Khosile Tlape, is always doing oversight at various hospitals around the country and in Gauteng in particular. And the situation is very dire. And so we are saying that the Constitution must not be weaponized to continue to aid and abet lawlessness and to normalize the abnormal. We need a situation where the same as applies to South Africans when we travel, you've got to be able to demonstrate that, number one, you're able to support yourself while you're in that country, and that you have medical assistance should you need it when you present yourself in that country. Now, we appreciate that you've got asylum seekers and people who are vulnerable who have left their countries to come to our country for a better life. But that does not mean that the Constitution and the provisions of Section 27 and other sections of our Constitution must be abused to accommodate people who have originally come into our country illegally. If people are here illegally, they are illegal. You cannot normalize the abnormal. And that's really where we are challenging the South African Human Rights Commission, who are always mum on other things.
Of course.
And for example, I want to also underscore very deeply that we've been writing to the South African Human Rights Commission asking them to help us put pressure, for example, for the people of Lily who are still sitting there underground, and the people, their families still camping outside the mine with no help from anyone else. And yet, and those people were legal South Africans doing their work, having gone to work, and nobody's saying anything about it. And so this is the hypocrisy that we're challenging as ActionSA.
You heard.
I mean, like, South African Human Rights Commission does not give a damn about South Africans. South African Human Rights Commission, they don't care about South Africa. They don't care. They don't care. There are so many instances where South Africans have said that, where is this commission? Where is this commission that is always quick to release the statements? Where is this commission? You remember, guys, the last time when those illegal miners were forcing the government to give them the cookies and nice things when they were illegally mining. The South African Human Rights Commission, they went there and said that the government must provide these people that are doing this illegality, they must give them everything that these people want. So the people who were mining illegally, they got trapped under there, and they started sending out the demands outside. And the South African Human Rights Commission was there to ensure that these people that are mining illegally are getting everything that they want. This is the kind of a group that this is. I don't take this group seriously. I don't take this group seriously, man. I actually think that this group is like a terrorist group. Like, honestly so. The South African Human Rights Commission, I think this is a terrorist group. Because there's no way, there's absolutely no way that you can be mum about so many issues that are facing the people of this country. But when it has to do with some sort of illegality, you guys are there condemning the illegality. Condemning the illegality. I think this is a terrorist group. I think so. I think so. So now they are weaponizing our constitution. This is what is happening right now. Exactly what ActionSA is saying. That these people are now weaponizing our constitution. They are weaponizing our constitution. So I saw a message. I think it was, I saw this message yesterday. So the government has also released a video, an audio statement about these things that are happening. And of course, they are condemning South Africans. Of course, they are condemning South Africans. They are condemning South Africans.
Government has noted with serious concern the incidents caused by groups and members of the public to block foreign nationals from accessing healthcare services at public facilities. Illegal immigration will never be condoned in our country. And
Why are you saying that the illegal immigration will never be condoned in this country when you, as the government, have allowed this situation to happen? Just imagine, man, these people from the ANC saying that illegal immigration cannot be condoned. What do you mean illegal immigration cannot be condoned? Because you have already condoned the illegal immigration. You have already done that. Because if you were not condoning the illegal immigration, then you were never supposed to allow the borders to be open. But now we still have open borders. And then you guys have the audacity and the cojones to release a statement saying that you are not condoning the illegal immigration.
illegal immigration will never be condoned in our country. And whilst the genuine frustrations of citizens are understood, equally taking law into one's own hands is a direct violation of laws of our country.
I feel like they are patronizing South Africans to say that we understand your cries. I feel like that is so patronizing. Because you are actively not doing anything about these things that South Africans are saying. And you are coming out to say that I understand what you guys are saying. So I feel like this is very patronizing to South Africans. That how can you say that you understand us and not do anything about what we are saying? And still have the audacity to release an audio statement saying that you understand what we are saying. Like this is so it is so patronizing.
Public is urged to respect the foundational values of our Constitution that affirms human dignity, equality, and advancement of human rights and freedom. Section 27, subsection 1 of our Constitution provides for rights for everyone to have access to healthcare services. It is equally important that the public note that government continues to address and manage migration-related issues in a lawful and orderly manner. Law enforcement agencies are continuing to deal with all individuals who are in the country illegally.
Just listen to that, man. They are saying that they are dealing with these people that are in the country illegally. And they are dealing with these people and that are in the country illegally. I cannot believe my ears, man. I cannot believe my ears.
In line with the applicable laws and immigration processes, South African police services, in collaboration with the Departments of Health and Home Affairs, are deploying public order police to maintain law and order at the affected health facilities, whilst continuing to prosecute foreigners who violate the Immigration Act. Government calls on all communities to uphold the rule of law, respect human dignity, and continue to work together to build a united and inclusive South Africa.
This bulletin.
You guys were supposed to uphold the rule of law by closing the borders. I don't understand why you tell South Africans to uphold the rule of law when you guys have totally failed to uphold the rule of law. Because if you guys had actually closed the borders, we wouldn't be dealing with this situation. We wouldn't be dealing with this situation, but unfortunately, we are dealing with this situation, and these are the consequences of voting for these comrades. We are dealing with these situations. We are dealing with them. I mean, like, it's quite patronizing, man. Like, to hear, like, we are doing something about this illegal immigration. The police are working hard to get these people out of the country, and we understand that even if we use the money to get these people out, they can easily walk back into the country because nobody is guarding the borders. But we are doing something about it. Taking South Africans for fools, because this is what they are doing. They are taking South Africans for fools. Or they have taken South Africans for fools. They have. So guys, what are your thoughts, man, about this issue of South Africans stopping the illegal immigrants from getting the healthcare in the public healthcare facilities? Please tell me what you think in the comment section. Don't forget to hit that like button. And the most important part is subscribe. My name is Thomas Mabaso. I will see you next time. Bye-bye.